guys, so we're going to go over chapter 4 of this Saunders NCLEX exam book. And chapter 4 is test taking strategies. So I highly recommend you spend time on this chapter. I'm making this chapter have its own video because it really contains a lot of crucial information and I want to make these videos pretty short. So here we go. So the first thing when it comes to test taking, just the two basic things that you have to think about while you're taking your exam is focusing on what the question is asking and process of elimination. So when you sit down to take your test, sometimes you can lose focus if it's a really long test, like the NCLEX could be. So it's important to just really read the question thoroughly. Make sure you read it at least 2 times because there are important words that you could potentially miss, or you could miss what the question is fundamentally asking. And there are a lot of ways that questions could be asked and different formats and different types of things that NCLEX questions are asking for, so make sure you read the question thoroughly and you focus on what the actual question is asking. You want to make sure that you're using your ABCs, so airway, breathing, circulation, for priority questions, and CAB for CPR questions, which are compression, airway, then breathing. So it's great if you're following along with the Saunders NCLEX book, but if not, that's fine. I just recommend you look up some of these styles of questions. So the umbrella option question contains broader or universal statement that usually contains concepts of other options in it. So the Saunders book says that this is the correct answer if you have an umbrella option. So look up what an umbrella option question would be, and maybe I'll link some below. So this is a really important tip that helped me out a lot. Close-ended words. Those are words like all, every, only. And if you have answers or options for answers that use these words, they're usually incorrect, because generally speaking, you're not going to have an answer that's saying, all the time you're going to do this, only do this. So there are going to be some questions that you're going to have to pull from your knowledge of therapeutic communication. And the thing about therapeutic communication is that it's not always intuitive. So you do have to study what it means and how you can implement it when you're communicating with clients. So I'll post a link below. But basically there are things like silence, focusing, open-ended questions, exploring, restating, reflection, things of that nature that you should really review before you take the NCLEX. Delegating is a huge topic. I'm going to link my video about delegation below because I just simply can't cover it within a short time period in this video. And also pharmacology. There are definitely tips and tricks to answering pharmacology questions, and I also have a series about pharmacology. It's a 3-part series. I highly recommend that you watch those videos. They contain everything about pharmacology that you need for the NCLEX. So as you are focusing on the question at hand, you're focusing on what exactly the question is asking. There are some tricks within the question to help you discover the answer. So these are called strategic words. Strategic words or phrases are things like immediate action, best, first, most appropriate, early sign, late sign, most helpful, priority. So the dreaded thing about nursing exams is that you have answers, or you have multiple answers, or seemingly multiple answers, but it's asking for the best or most correct answer, which can be super annoying, especially at first when you're trying to learn all this information and you're like, oh my gosh, like 3 out of the 4 of these could definitely be right. I'm sure of it, but you have to choose the best answer. So the strategic words are extremely helpful in figuring out what the absolute best answer is. So a negative event statement is something like, which statement indicates a need for further teaching. So you are finding the thing that the client says that is untrue, right? So you have to be careful with that wording. Positive event statement is something like which statement indicates the client understands the teaching. So that means what the client says is correct. So there are a lot of analysis type questions. So these are questions where you're going to be really utilizing your critical thinking skills. They are scenario based. Some of them are just straight knowledge based, like lab values. So you want to focus, visualize the event happening in your head. You can ask for a scratch paper, I believe, usually before the NCLEX. Obviously, make sure you do it before you take your exam. So take advantage of that. So my personal absolute number one tip when it comes to test taking strategies and studying is to do as many questions, practice questions as possible before you take your exam, and just spend most of your time studying the questions that you got wrong, reviewing the rationales behind what you got wrong, and if you continue to get the same sort of thing wrong, go back into your textbooks and figure out what you're doing wrong and absorb that information. So check out the video that I made right after I did my NCLEX and passed it. That was really fresh information, so if you want like a full, well-rounded view on what to expect during your test, definitely check that out. I'll link everything below, and if you have any questions, just leave a comment and make sure to like and subscribe. Thanks!